All right, welcome everyone to our FIC national meeting. We have a lot to discuss today, so we will get on to it. Wonderful to see all of you joining us. Let's start with Chris Gray, our lobbyist, and we will take it from there.
Sounds good. Thank you, Trisha. And I know both Sara and Scott probably have a little bit of an update that they want to chime in as well with regards to our advocacy update. But lots has been going on lately. We have the federal budget coming up Monday afternoon at 4 p.m. Eastern, which we will obviously be watching closely for a few initiatives. I know Sarah's been doing a great job in leading the call for the medical exemption to be considered in this year's budget. So we're watching closely for that. We're also watching to see what they're going to be doing with the CURS and the CUES programs, which it's sneaking up on us that those are expiring in June. And a lot of groups, including ours, have been calling on the government to continue to extend those because, as many of you know, we will not be out of the situation we're in by June the 5th. So I'm quite hopeful that there'll be an extension of those programs in the budget. So we have, I know Sara has drafted news releases that will go out on Tuesday morning, both, I guess we'll call them pro and con, Sara, where we have, it's a good situation and we're saying some good things about the government. And then if it's not a good situation, we will be, I suppose, equally expressing our disappointment in the federal government for not taking the actions that we have been pushing for many months now.
Yeah.
So just a few other things, and then I'll turn it over to Sara and Scott. Scott did appear before the House of Commons Health Committee on Monday afternoon. That's FIC's second committee appearance in the last 6 months, I want to say. So that was really great, and Scott did a really good job in appearing and talking with MPs about the issues with fitness facilities, but also Canadians in general. We also met with an official. Her name's Holly in Aaron O'Toole's office on Tuesday. Predominantly, obviously, bring her up to speed on where we are and what we've been doing, but starting to also take a look at moving forward. What could we put in the Conservatives' window for a potential election platform issues as well? And I think that was a pretty good meeting that we had with Holly on Tuesday. I think that's about it from me. I don't know, Scott, if you want to speak more about the HESA committee appearance, and then maybe Sara, you want to speak about where we are on the budget ask.
Yeah, I think the one thing we were actually asked to appear, so they know about us now. So I think that's a lot to do with what Chris has been doing from a lobbying standpoint and our messaging. So, and all the work that Sara's done. So they asked us to appear. They had some good follow-up questions. I think the tone was generally very positive. So, we're really optimistic that we have a pretty good chance here for good news on April 19th. So just cross your fingers and your toes and your hair and your eyes and anything else you can cross. So it gets pushed through.
Great. And Sara, do you want to chime in?
Yeah, I think that Trisha, Scott, and Chris and I, we met last week to formulate our press releases. As Chris spoke about, we have both of them ready, and just making sure that as an industry, if on Monday we don't hear that this is going forward, and we're going to manifest positivity and believe that this is going to happen, but if it doesn't happen, I think that we've crafted something that is strong and shows that the fitness industry, that we will continue to band together and that we will continue to overcome this. And so I want us to be positive and hopeful And at the same time, if it doesn't happen, for us to not feel that it's a big blow or to feel deflated, because I know that because of our membership, because of the power of all of us coming together, I know that we can still forge ahead, and there's other options. There's plan B and plan C, and we will absolutely go at those really hard and strong. So I just want everybody to feel confident in, we believe that it's going to get passed on Monday, but if not, we're still going to be very, very strong, and we will overcome.
Wonderful. Thank you for that update. Are there any questions about how we are moving forward on this? Don't think so. Okay, excellent. So that being said, let's maybe move on to FIC initiatives and any updates. So I'll get Scott to kind of introduce anything that, or things that FIC is currently working on.
Yeah, we actually have a board meeting following this meeting where we're going to be talking about our vision statements. So everybody's had the opportunity to give input on who we are and what we look like as an industry in the next 5 years. So I've tried to craft, at least start the process of that statement, our vision statement. And once that's done, then we're going to move on to our mission statement, which is what we actually do. But we had lots of great feedback, which is awesome. And then we've also been in conversations with the Canadian Federation of Independent Business, the CFIB. So you've probably all heard of them. They're very well organized and active throughout the country, and great lobbyists. And so we're looking to see, are there synergies with our association? What type of pricing and benefits could they provide our members? So if you have an FIC membership, you would, in theory, also have, or potentially, have a CFIB membership, and you'd also have all those benefits. So, and they do a whole bunch of things besides lobbying. They also have, insurance opportunities. They have professional development certifications. They have networking events, roundtables. So there's quite a laundry list of benefits that they provide. So we're going to just walk through some of that, and if it makes sense, then we'll present it back to this group. And I think it could really help all of our business owners to, give them more tools in their toolbox. So we're pretty excited about that. And then we'll go through the provincial reviews. But as you all know, it's been a interesting couple of weeks, and we've been responding to many interview requests depending on what the event of the week has been. So, and I think we can get more into the granular details as we go through the provinces, but it's been an interesting couple of weeks for sure. So Trisha, I don't know if I'm missing anything, but I think that's really it at a high level.
Yeah, no, that's great. And then I know there's a lot going on in the provinces, so we can allot for more time to speak about that today. But I do want to just mention that National Health and Fitness Day is coming up on June the 5th, and our National Health and Fitness team task force has been working tirelessly to make sure that we have programs in place. We are revamping our gympass.ca website, and we are currently looking for volunteers to provide little clips and connect with the team to provide sessions and workout sessions in their community. Mo, did you want to speak to that just a little bit here?
Certainly, thank you. So yes, the initiative, as many of you may know, is outdoor, small community, connecting people with fit pros, and using it as an opportunity to encourage all Canadians to get active, not only on this day, but to make it part of their lifestyle. And we know that health is at the forefront of most people's minds today. So we think that this year in particular is a great opportunity for us. But secondly, and as importantly, to have fit pros really connect with their community and ask for support, ask to be heard, seen, respected, and to really help to connect And this was inspired by just local grassroots getting active on my street as an example. And some of you remember the story I shared. And then Natalie nominated myself along with herself to create this task force. Trisha, you've been excellent bringing information. We're meeting also this afternoon. Just to wrap up the loose ends, we're trying to make it as easy to access as possible, or otherwise known as a turnkey program. Everything will be available on the website. And while we'd love to make it a big event within people's communities or cities, we really know that it's going to have to be very small events, but many of them, which is going to be great because more fit pros can get involved. And we hope that more do in everyone's community. So if you are here and you want to participate and do more than just something in your own community, please just reach out to me. I'll put my email in the chat box here, and I will connect with you and send you where you can find more information. But thanks everyone for who's involved and for your support.
Wonderful. Thank you, Mo. And this really is a way for us to kind of highlight what we do as an industry, as well as supporting Canadians and our neighbors and making sure everybody is checked out when it comes to health, physical or mental. So it's a great day to kind of plug what we do as an industry in kind of a low-key, fun way. So let's go on to our second part of today's call, which is the provincial updates. Now, we'll start with Quebec, and we will go from there. So, Gabriel,
Yes.
what's happening?
We like to start with Quebec, so we speak weird, and after it's funny. So crazy 2 weeks or 3 weeks. We had the biggest explosion of case in the Canada right now with the mega gym. I'm sure you have heard of it. So 500 and more cases related to a gym in Quebec. That was the same gym that was going against the rules and pretending that he was going to open on last October. So unfortunately for our industry, we look very bad, and all the media came to focus on a gym and all the cases. And at the end of the story, there's a guy that was training there that died at 40 years old. So you imagine like all the media coverage of that. So since a few weeks, we are in the media trying to expose that fact and say this is like an individual. It's something completely not rare, but it's like all the statistics and the data right now are not showing our industry is unsafe, and we try to focus on that. But for all the negotiation with government, each and every MPs and everybody at the government don't want to like back the gym at this point. So we are a little bit alone. We do a lot of media stuff in the last weeks, and but they still are focusing on the guy in the gym. And even today, 2 weeks after, there was a big thing in the journal saying again like the gyms are place where people think because they are healthy they are not like they are not able to have COVID or something like this, like they do stupid stuff. So we work hard to balance the other side. We present a lot of letters to the MPs and a lot of letters to the media saying that we focus on 3 things here. First is recognizing the professional as health workers. So saying like you close the gym, it's okay, but like there are professionals that had a tough time since 1 year. We were closed a little bit more than 9 months now, so we lose a lot of professional. We need support, like to keep our professional. We need them to be recognized, and after we focus also on after the crisis. So we need a strong message that Quebec people or whatever Canadian, but the Quebec people now they need to work out more and move more and benefits from being healthy by physical activity. So we are focusing on those 3 key messages, and we are also supporting the members by like a logo they can put on the gym saying here we practice safe fitness, we follow guidelines, we are in a group, and we have strict protocols. So I think this is something members like. So this is it for us. Natalie, do I forget something or?
I think because there are some people across the country that have reached out about this case. It did get national attention because, like Gabriel said, it's up to 500 cases now, and there was a death of a member of that club. And from us, so we worked immediately so that you guys know with the PR firm that we have here and the lobby firm that we have in Quebec to put out a statement. And I know it was so that everybody knows it was really challenging to find the right PR angle of distancing ourselves from him while not making the story still about that gym, but making the story about the rest of the industry and making the story about everybody FIC is doing, while at the same time saying we're not them, because that's the reason everybody picked up the phone. So we went through that as smoothly as possible. Saying we do things well is much less newsworthy, but you kind of want it to, there's a certain extent to which you want it to be newsworthy. You want to be attached or detached from what is happening that's newsworthy at that time. So it's really tricky. It's really challenging. We've done our best. It's really frustrating because it does affect the way people view the entire industry. It helped that he is, and I'll just put it out there, he's a conspiracy theorist, doesn't believe his masks. The members said themselves they were wearing masks, and he said, don't do that. You know, that's just a con. He doesn't believe in COVID. They closed him down. They didn't close. The cops had to go physically close down the gym. So all of that kind of helps it to be, it's this guy. It's not the industry to a certain extent, but it unfortunately did happen in the gym. And so we're doing what we can to keep putting out the good news and use the opportunity to keep highlighting what we do like Gabriel does, but it's very challenging. And it did, unfortunately, shut down all of sport in the province, including until 24 hours ago, all outdoor sport had to be masked. But then the Premier's golf friends got upset, and now outdoor sport doesn't have to be masked. So literally in 3 days, we got 3 different decrees in Quebec. No masks outdoors, no masks outdoors. And so just keeping up with the decisions of what's happening here is really, really challenging for that. But I think one thing I would invite all of us to do, and this is what's getting Gabriel and I are having trouble a little bit. All of us are challenged to do right now is to, yes, support that the industry is part of health, but I would say there's a really fine line between that and saying, if you're healthy, you won't get COVID, because that's what some of the people in the industry are starting to do. And that's what the media is picking up on, which is our whole message of you also need to eat well, you also need to be physically active, you also need to do this, is starting to smell like if you just did this, then you wouldn't risk either getting it or, really more importantly, suffering or dying from it. And they're starting to pick up on these people in the industry that are saying that. So there's a fine line between the, you need to keep us open and we're a part of the solution, and we are the solution, rather than everything else that people see. So I would just invite us to be careful of how far we push the fitness is the solution to morbidity and mortality of COVID, because right now it's the media is really starting to pick up on it, and it's feeling more and more like one-sided news that's coming out there, because they're finding more and more people from the fitness industry are singing that song. And so I just wanted us to be aware of that I think we need to be careful, because anybody who says that is still being put into that bucket of, fitness is important and everything else that we're doing to prevent COVID, not instead of everything else that we're doing to prevent COVID. So that's it.
So Natalie, do you feel that we should be reaching out to those reporters to be proactive and get our stance known?
We can. I certainly think we need to respond, and I will respond to the national one that came out there, and Gabriel is looking at the other ones too. Some of them did reach out to Gabriel and still printed what they're printed, because that's what's selling. And I don't know if it's really any reporter's duty to put out something that's fair. They put out something that's newsworthy. And so for us saying that's not a fair report, I don't know if that's a dig to them. It's the news that they found. And so yes, we need to keep putting the message out there. And just being, again, it's the fitness along with everything else is important, as opposed to instead of the other things we're doing.
For your answer, Scott, the biggest interview that I did this week was like more than 30 minutes with the journalist, and I sent to her a lot of studies, fact about fitness, about like, and I even say to her, we are not like, if you are healthy and you train, you can have a heart attack. You know, you're not like oh, you cannot have any health issue, but if you're healthier, science says like it's better for you. You know, so I put facts and everything, and in the media that came out today, I'm just saying like she wrote just one thing. Fitness industry is not just about doing biceps. So after 30 minutes, you know, after all the fact, after emails I sent to her, the only sentence from me is we are not just about biceps. So, you know, they have an angle right now, and they like it's selling. If you go to the Facebook of that media, that journal, like the news today, it's over 800 sharing and comments. You know, it's working. So they're gonna continue to do that, because like bad news and hate, this is selling a lot, and good news and healthy and doctors saying you need to move. This week you had the study in I think it's in England from 50,000 people saying like if you are sedentary, COVID is going to hit you harder or something like it. I'm sure you saw it. I share with her that study, and it's like phew, nobody cares, you know. One guy had 500 cases, and even in Quebec right now, I talk with public health the director here, and they have so much cases around Quebec right now in the garage where you sell car, in construction. Like they have 10 times more cases there. Nobody talk about it. They even have in Parliament in Quebec, they have an explosion there. Nobody talks about it. So it's all about gym.
One of the things, just if anybody's asked for an interview, I was given this advice, so this isn't my advice. You can say, I'll do the interview, but you have to make sure that this point gets across. Otherwise, I won't do the interview. And they'll say yes, and then they'll actually do it. I actually did that last week with CBC because we've all done it where you get interviewed and you spend half an hour and they take a little tiny bit of what you said, and you know they already had their story. They're just looking for content to fill it. So just one thing I learned is you can say, I'll do your interview, but this point needs to be in there. And if they say no, then just say, well, then I won't do the interview.
But honestly, Scott, and we can, I know we have a lot of people to talk with today, but honestly, like when this came out, a lot of media reach out to say, do you want to like balance the news? Like everybody is talking about the bad side of the industry, but can we balance it? So there was a lot of media wanting us to present like all the good side of health, being healthy and fitness industry, and all the measures we did and all this. So we had a lot of exposure around how safe we are, but it did not get traction. So, you know, they want to sell something, so they need traction. So we did like 10, 20 interviews, but what is selling right now is hate. So it's coming back 2 weeks after, and it's just tough because nobody care about the fact that we are part of the solution. Like being healthy is good, and COVID is going to pass, and we're going to have to be healthy because there's much more problem in the world after this pandemic than just COVID, but it's not relevant right now. So we continue to work.
And thank you so much for all that the Quebec team is doing to mitigate this situation. So I know we all are grateful for your hard work and are learning from you as well. So thank you very much for that.
I learned everything from Carl and Sara, so you can take it.
Sharing all the knowledge. I love it. Okay, let's move on to Ontario.
Yeah. Okay. So in Ontario, there's a lot going on as well. Obviously, we're a province-wide stay-at-home order, and I didn't have a chance today to check in, but they were signaling they're going to put even further restrictions and close down more businesses. They've closed down the schools. The schools are on break and they're not going back to in-person learning. So obviously it's extended here, which on the one hand, one of the things that we are seeing is there's a lot more public backlash this time than there's ever been. People are so fatigued that a lot of people are really, really fed up with this, especially a lot of business owners. And so, which I'll talk about sort of in a minute, and some of the things we're seeing in Ontario that are happening. But obviously, it's a really critical point here where we're locked down. It's going to be at least 4 weeks. The numbers we're at the highest numbers ever in Toronto the last 2 days, or the province, I mean. And so we don't know how long this particular lockdown is going to last, but it doesn't look like it's going to be just 4 weeks. It could extend all the way through until June. So that's just what we're facing. That's the stuff that's a bit out of our control. One sort of positive or kind of double-edged sword thing that happened here was one of the gyms here challenged the government around the Disabilities Act. And it forced the government in February unannounced to make a change to make an exception that gyms actually had to be open for people with disabilities if they need physical fitness that they can't get anywhere else as part of their treatment. So that was, on the one hand, a very positive thing, that it was, and a number of gyms sort of are using that, are opening for people with disabilities, and that the positive signal it sent for our industry was just that, fitness is an essential part of health, and especially for that population, but of course that extends to everybody. And that under that rule, they actually let gyms open with up to 50% capacity for people with disabilities, which again, I used in conversations with the government last week to say, Eric's pointed out, like, gyms could open solely for that purpose. And I'll get to that in a second about some of the things we've seen with that. But a point I use with the government is to say, look, if it can be open for people with disabilities, like, it obviously extends to all people's health. And if they can be open at 50% capacity safely for people with disabilities, why doesn't that capacity apply when gyms can be open again? Obviously not today when we're locked down, but when we can be open again. And they kind of went, yeah, that's a good point that you've made there. So there is some opportunity there. One of the challenges with it, and why Eric pointed that out in the chat, is some gym owners are basically encouraging their people to go get a note from their doctor saying they've got disabilities so they can come into the gym. So it's an exception that's designed for a specific purpose, and we're very concerned that people are going to stretch that more than they should. And so that's where we're very, very worried about it. And when it came out, the gyms were doing it. The press did run with that, of course, and they made a story about how there's a bunch of gyms opening in an area under this. And unfortunately, one of the gym owners made a comment, said, everybody has a disability. And it's that type of attitude that, of course, that's what the press ran with, as opposed to the fact that this particular facility they interviewed was actually opening for a population with disabilities. So it's like I said, it's a double-edged sword. It's one positive thing, but with a lot of potential drawback. And on the other hand, we are seeing a lot of gym owners who they're just fed up and they're going rogue and they're saying, I'm opening, and at least the justification for opening isn't like too far out there. It's basically like, my community needs this for their mental health. I've been closed for a year for the health of my business, for the health of my community. I need to be open. So it's a relatively a lot of them are framing it in a decent way. It's not like too much like, I'm rebelling against the government. It's trying to phrase it in a positive way, but we're seeing a lot of those people, just because at this point in time, some people have been closed. Like in Toronto, gyms have been open for 70 out of the last 400 days, so and in most regions, it's been at least 7 or 8 of the last 13 months, 8 or 9, sorry, of the last 13 months. In Toronto, it's 11 of the last 13 months they've been closed. So people are at the end of the ropes, which is totally understand. And for some, that means they're going rogue. For some, they're using whatever resources and whatever exceptions they can to try and get as many people that they can get in a legal way under this exception. And there is that positive signal, which we're trying to use in our conversations with the government, which are still very limited. So that's there is a PR campaign that is being organized by Movati and Orange Theory to try and get some press out on this, to to deliver the message that The fitness industry, we've been shut out of conversations with the government. We've been treated completely differently and unfairly relative to other industries when obviously we can do a lot more to mitigate risk than other industries can. And that's a lot of the central push we're trying to highlight is here are the things we can do to mitigate it. This is relative to other industries who are getting different rules, and the data backs us up on this. The data from the government, the data we've got, it all backs us up that we can mitigate risk more than anyone else. And so that's really the message that we're trying to get out, not around being open and right now, but so when we are able to reopen in the future, that we have rules and restrictions in Ontario that make sense. And in the interim, the fitness industry needs to be a part of this conversation so we can talk about restrictions that are both safe and viable for the fitness industry. And we're hoping that we can get some traction with the PR campaign. I am in conversations with the Ministry of Red Tape and Small Business. So we're hoping that they'll take our proposal to the people that are adjusting the framework, and we can at least get one positive signal to send to the industry that, look, they're going to make an adjustment, just like hold tight until you can open again. If you're going to be opening under the Disabilities Act, like, please do it the right way for the right people and the right populations, to make sure. And the person who actually won the lawsuit stressed that in the call she was in, to say, don't abuse this, or else it's going to look really, really bad for our industry. She also has another lawsuit this month that's going to court where she is sued to be declared fitness as essential. So we'll see what the results of that are. I don't know. She felt positive about it. I'm not sure what the outcome of that's going to be and how they're going to look at that, but that's an interesting thing happening that's on our radar. And I just want to echo what the team from Quebec said here. Like, there is this real, with all these challenges, there comes this opportunity, and especially for the FIC itself, to differentiate like the standards that we put and what our members do, and really, really try and stress that in any press we get. And I know it's really tough to get it picked up, and that's why we've got to go out with our own PR and try to control the narrative here. And again, just stressing, like, this is what gyms can do to mitigate. This is what the data backs up, which I update every week. And our percentages of outbreaks and cases are lower than retail, lower than bars and restaurants, far, far, far lower than schools and other places of employment. So it is backed up that way. One thing to be aware of, one of our members pointed out, I don't know if everyone's seen this, but there was a survey that went out to 1,500 Canadians about their attitude towards what should be closed. And unfortunately, 69% of Canadians said gyms should be closed. And 50% said restaurants, 31% retail. So we were the second highest, next to like sports and concert venues was, slightly higher. But the public sentiment is, 69% of those surveyed in this particular survey said they want gyms closed. So what we're trying to do, the challenge with this PR campaign, is finding the right timing, in the middle of further restrictions, numbers going up. That's the public sentiment that we're aware of. We know what the healthcare sentiment is because the hospitals are completely overwhelmed here. And I've talked to doctors and nurses that are verifying just how dire the situation is here in the hospitals that they're seeing. So just the timing of it is going to be very key in terms of when we do this, because it's very tone deaf when we're in the middle of crisis to be going out and talking about it in this way. But it's also a real opportunity to highlight those things and try to hammer home that message of what gyms that are doing it right are doing to do that, and how we can be part of the solution. And also walking that fine line behind basically calling out the Ontario government to say, we've been treated unfairly and you haven't engaged with us, but hey, we're here, we want to talk to you, and not totally being too confrontational. So that's everything going on in Ontario. So a lot. And hopefully we have some good news to share in the next couple of weeks in terms of the conversations with the government, and we'll see when this PR campaign does go out, what the general response is and how it gets picked up.
Great. Thank you so much, Nick, for that update. I know there's a lot going on, so we'll make sure that the information is connected with, and looking forward to the campaign as well as the press release that Movati has in the works. So let's move to Manitoba. Dino, I know you're watching the news, the update. So if you're able to share with us here.
Yeah, so I'll try to be a little bit more positive, I guess, with a lot of the other negative news across the country. Manitoba's kind of got a wait and see approach. I think we got a little lucky with the case numbers and everything. We're up, and our test positivities it's pretty high. But we had another press conference today where Dr. Atwal basically said it's wait and see. Lockdowns are very much a last resort. I don't see them implementing one anytime soon. He just basically begged people to make sure that they're leaving houses for essential reasons, avoiding gatherings, all that kind of fun stuff. So we could see a press conference early next week. I was talking to a few contacts in the media, and I have two inspectors that I talked to that have told me that there's probably some changes coming next week that involve just group sizing, bringing those groups down, maybe reducing the amount of gathering and stuff like that. And then they also mandate, because we do have the universal indoor mask mandate, but they were also talking about outdoor, just because we are very active outdoors here with things like the parks and the zoos and all that kind of stuff. So that might be another thing that we see. But in terms of directly impacting gyms, I don't see any changes at all. I feel like they're probably going to keep us at about 25% capacity. Same thing, mandatory mask, just kind of the status quo is likely going to stick around until everyone's vaccinated. At least that's kind of what the impression that I got. I feel like it's actually been a while since I've done an update. So I'll just also update on a few other things. I did do a freedom of information request, and I don't know if I updated anyone on this. This was months ago, but we did just want to see how many cases were linked to fitness centers in Manitoba and kind of how that information may have related to some of the policies and procedures they put in place. So what we did find is that from September 1st, or about the start of school, until we were closed November 11th, there was roughly 400 close contacts or people that tested positive that visited a fitness facility, right? In that same amount of time, there was about 8,000 cases. So that's about 5%, which is lower than what we would expect if we thought, let's say, 12 to 15% of Manitobans had a gym membership. You would expect the number of people getting sick to be a little higher. So actually, it kind of works in our favor that the numbers are substantially lower. Saying that, when I did kind of reach out to some epidemiologists as well as the media, basically all they're saying is our contact tracing is so poor that our ability to differentiate where people are getting the virus is just, it's non-existent. So 400 people visited gyms that tested positive. It's very likely that none of them acquired it here, right? It's just that they at some point traveled and visited a fitness center either for work or for exercise. But saying that there wasn't any mention of any transmission, it was just these people at some point had been in a facility. So I think that's good for us. Yeah, and Kate's right. Yeah, not the gym's contact tracing, but the province's ability to do contact tracing has been poor the whole way through. So that's one topic. The other thing that I wanted to update on is we had, in the heart of our second lockdown there, we had really done a good rally of getting all the facilities together, these meetings, and getting some letters written, and really did a blitz in terms of trying to contact some of the levels of government. Our very first written response Friday. So that's over 4 months it took to get a written response. And that written response was actually just a canned response. There was no specific details, just kind of like, here's the orders as they stand, and we're doing it for public's interest. So as you can see, communication with the government not very forthcoming there. We've sent many letters since, so I'm assuming it's going to be a while before we get a reply. And that was one reply from the 30 to 40 different ministers and politicians we sent letters to. So you can see that they're definitely taking their time. The last thing I want to touch on here are two things. One, we're having a slight issue with facilities kind of not being on board with the mask mandate, really wanting to push back. There's a larger brand of gyms that did get a meeting with the government on their own accord, not as part of the FIC. They kind of got a meeting with the government, and they kind of said, what's this idea of masks here? And the government basically pushed back and said a mask is a no discussion. Like, we're in the middle of a third wave here, so we're not going to be removing that anytime. Yeah, there was no other changes from that. And the last thing is just some suggestions that I've done here in my facility, just with ventilation and HVAC, and really making sure that, you know, we're doing the things that we need to be doing, because the consensus is that COVID is airborne. It's not just droplet transmission. You know, this in the last few weeks to months here, a lot of the research is showing that COVID is airborne, and that there's things we can do with HVAC just to give people confidence. One is I've adjusted our HVAC to pull in fresh air instead of recycling the air. The other is to have the fans on all the time, so it's recycling air, and then just put fans around the floor. And these are things that really don't cost any money, but again, can provide some protection, but also a lot of confidence from your members. And these are things that I, you know, kind of tell my members that I'm doing. You know, these are the things that we're doing to keep you safe, and it provides confidence. So I think that's it for Manitoba. So hopefully that's positive.
Great, thank you so much for that update, Dino. Let's go to Saskatchewan.
So not a whole lot on our front. We haven't seen anything change actually in coming up 6 months now for us. So we are still under 3 meters of spacing for restrictions up to April 26th here. We still have the masking while working out, and the masking while working out, 3 meters of restriction, and we are limited to 8 for group training right now. So we are not seeing anything change, and I don't expect it to probably change for another, I would say, two months at least. We do have the NDP now who has drafted a letter that will be going to the government on our behalf, talking about the fitness tax incentive for us. So basically the ask that we had in the media. So hopefully we get some more traction with that. We are still seeing a few facilities kind of going out on their own, really pushing kind of their own agenda there that have caused a few problems, but nothing major on that front. We've had 2 gyms recently that have had smaller, I would term it, outbreaks, but when the gyms have done the contact tracing on their own, based on the dates that people were there, even though the government was saying it was the gym, they can show that the people were hanging out outside of the gym on personal time and likely got it there. So, but nothing else major here for us. We'll see what the ask from the NDP does for us. And really, we're just in a wait and see for us here.
Okay, thank you, Jolene, for that update. And we'll also keep our fingers crossed there. Let's move on to Alberta.
So Alberta's been, as everywhere else, fairly interesting. We've been pushed back into phase 1 or stage 1, which means facilities can be open, but for private training only. Group fitness needs to be outside. So, you know, that obviously isn't an economical model. So you've seen many facilities, you know, they're open, they're defying the order. There's a real surge of support for these folks, actually, you know, by their members. And, you know, that's a small percentage of the overall population. So in general, you know, they're painting the industry in a negative light. I've actually been asked to do an interview this afternoon on it. You know, when you talk to some of the owners who've been creative with how they think they're going to open, you know, they're just at the end of their financial ropes. People are desperate. They are literally running out of money. The government announced an extra $10,000 for owners, so max of $30,000, which is, you know, usually 1 to 2 months worth of losses. So many facilities are at the end of their financial ropes. Many are acting out in inappropriate ways. You know, so it is, you know, there's this phrase being thrown around in the media. It's the race between the variant and the vaccine. And, you know, in Alberta, they're still talking about planning the stampede in the summer, which is just bizarre to me that we're in this stage and even thinking of something like that. You know, we try to hold the government accountable and say we need more support. We need more financial support if you're going to force us to close. But we do have operators that are acting out, and, you know, some of them are acting out to make a political statement as well, which is, you know, unfortunately really dragging industry down, because that's what the government, or that's what the media is going to hang on to. So we're in damage control mode, and many operators are trying their best to pivot and the best they can, but the ones that are operating illegally and inappropriately are really hurting us. So that's Alberta, unless Blake, you think I've forgotten anything.
I think you did an excellent job, Scott. I have nothing to add.
Great, thank you. Then let's move on to BC.
Hello, everybody from British Columbia. So 2 weeks ago, we had the opportunity, that FIC had the opportunity to, for the first time ever, discuss new individual gym requirements with public health directly. So they created a draft. There had never been individual gym requirements on the BC Public Health website. There was only high intensity group, which is currently shut down. Low intensity group, which they recently shut down, but there were no independent gym requirements. So they came out with the first draft of requirements, moving while exercising in a facility to 4 meters. And we were able to work with them to bring that to 2.5 meters instead of 4. And we advocated for a business perspective and a health and safety perspective. They went to masks at all times, and we agreed to that as long as we didn't have to distance at further than 2.5 meters. So we had a pretty good back and forth with public health, and felt for the first time ever that we had been heard. So we felt like it was a pretty big win for us. Also, we were at a point where public health in British Columbia, really the feel was they just wanted to shut down all gyms. And so Sara and I and our group in British Columbia got together, and we know that shutting down all gyms in British Columbia would make it harder to open up low intensity group and then open up high intensity group. So we needed some sector of our fitness industry open in BC to have a foot in the door. And so we were able to do that and work through some of the requirements. We are currently working, one of the requirements is that 24-hour fitness has staff on at all times. So a lot of 24-hour fitness facilities around 9 or 10 o'clock won't be staffed until at some point the next morning. So we've worked directly with Anytime Fitness, a few club owners out here in British Columbia, and we've put together a letter. We were able to, Sara and I were able to get in front of Dr. Bonnie Henry's team, present the letter in which we've put some guidelines and requirements together for 24-hour fitness so that they don't have to staff up during the night. Currently, Dr. Bonnie Henry has that on her desk in front of her. She's mulling it over, is what we've been told. So they're either going to get back to us via directly to Anytime Fitness or us. So it's in the mulling over stage. So it's a positive that we actually got a nod that Dr. Bonnie Henry has at least acknowledged that she's received it and she's mulling it over. So it's been really good to work with the Anytime Fitness group in BC on that. It's been really positive. So thank you, Anytime Fitness in British Columbia. We had, Sara and I had an opportunity to do an interview with the Kelowna newspaper that initially blew up the story on the Kelowna gym that wasn't allowing people to wear masks inside their facility, as well as wasn't allowing vaccinated people inside of their facility. So we got on next day with the reporter that initially was on top of that story, and we positioned ourselves as we are Fitness Industry Council of Canada representatives. We said that we didn't agree with the club owner. We shared everything that the FIC and fitness facilities that are a part of the FIC are doing to help support public health, that we supported Interior Public Health for shutting them down, that they shouldn't be open. And we went into some of the things that we are going through in British Columbia, which I'll share with you in just a moment, to support public health. And so, we're grateful to have independent gyms open. We're frustrated that low intensity and high intensity gyms are closed, but we should be doing everything we can to work with public health and to support our communities to be healthy and safe. And so that was our messaging. So we'll see how much of our sound bites they actually put into this next article, and we'll share that with you guys once that's published. We're also trying to get on Global News BC, because they did report on the story as well, and share our position on behalf of the Fitness Industry Council of Canada as well. Right now in British Columbia, as I've mentioned, independent gyms are allowed to be open. One of the things that we found out very quickly in British Columbia over the last 10 days is that gyms are now considered to be workplaces, not that they weren't before. So this is, I'm going to try to explain quickly and clearly. I'm not great at it. But what we found out through some temporary closures in British Columbia is that we are going to be considered on the same threshold of exposures as, let's say, a retail outlet that sells candles. So if you're a candle store, you may have 20 to 30 people within your business every day, if you're lucky. And so the chances of exposures within your facility are very low. However, in gyms in BC, we're likely, other than maybe grocery stores, we're likely the highest visited business in British Columbia right now. So if you have, let's say, 40 people an hour in your gym, you're going to have the same threshold as a candle store that has 30 or 40 people a day in it. And the concern that we've had with that in British Columbia is just like Dino was saying in Manitoba, we're at a point where the contact tracers aren't able to identify exactly where everybody is transmitting the disease. And so there's a threshold in British Columbia right now of 3 exposures. So if you have 3 exposures within a period of 14 days, you're on some sort of a magical radar at that point. And they do work hard to try to identify that those 3 exposures didn't occur within your facility, and I should change that. They try to confirm that they happened outside of your facility. They don't try to prove that it didn't happen in your facility. And if any one of those exposures can't be proven to have occurred, transmissions can't be proven to have occurred outside of your facility, you're shut down for 10 days, no matter what, no questions asked. And so the problem with that is that we have so many people within our facilities, and exposures are not our fault, right? We cater to our community who likely have COVID-19. And so that is going to happen within our facilities. Our job is to ensure that they're safe, whether they have it or not within our facilities. And so if you can imagine, David Hardy comes into a Club 16 Trevor Linden Fitness, right? He's asymptomatic, because you're asymptomatic, we're told in BC, 2 days before you actually start showing symptoms. And you get COVID, David gets COVID-19, and David is called by a contact tracer, and the contact tracer says things like, have you been to the bank? Have you been to the gas station? Have you been to the gym? And everyone remembers going to the gym, right? But I wasn't sick when I was in the gym. Yes, but you were sick 2 days after, so you actually were able to transmit the disease while you're in the gym. And then they asked Dave, have you been out hanging out with your friends, right? Have you been sharing drinks and vaping with your friends? And of course, Dave is going to say no. And so at that point, they shut down your gym, because they established that the likelihood of that person getting COVID-19, so basically they can't prove that they got it hanging out with their friends, so they shut your facility down. So yeah, so it is a case of guilty till proven not, sort of thing. And so I'll give you a quick example. So at Club 16, we've had a few of our locations temporarily closed. What we've done to counter that is we've decreased capacity to a point where business is not great because of it. And I'm not complaining about that, because we are open, I understand, and I'm grateful for that. But even at the capacities that we have now that are limited, we're still seeing the same issues. We reopened our Langley location, and here's an example of the frustration and what we're sort of living with being open right now. We opened up our Langley location on Thursday of this week. Our last exposure was on the 5th of April. Now we opened on the 15th, but 14 days after that last exposure, not transmission, but exposure in Langley, is the 19th. So we reopen on Thursday. If we have one exposure, meaning if one person comes into our facility that eventually gets COVID-19, whether from us or not, they're going to shut us down unless it happens after the 19th. So there's a 14-day period that you have to not have your facilities have an exposure since your last exposure if you've been shut down. If that sounds complicated and crappy, it is, because that's sort of what we're working with these closures. There's multiple operators on this call right now from British Columbia that have had temporary closures, and so that's what we're working with. We get inspected every time we have a temporary closure. Actually, a lot of the times, even when there isn't a closure, and we pass our inspections with flying colors. So it's not us not keeping people healthy and safe. It is actual exposure numbers within our facility. So the advice I have is to just try to minimize the amount of people within your facility until we get through this. And so if you need any advice in British Columbia on that, so there's obviously obvious friction. I'm not trying to go on and on and on, but I think it's an important point here for British Columbians. One of the frictions that we have is that we can't share a lot of information with our members. So when we temporarily close our doors, we often don't get exposure letters until about 10 days after the exposures. So we're sharing exposure letters with our members 10 days after the exposures because Fraser Health is 10 days behind on updating businesses when they've had exposure. So it looks like we've been holding on to exposure letters for 10 days. We get shut down, then we're sharing the letters and we're hiding things when that's not actually the case. It's not a very great situation to be in BC because it does appear to the public that there are multiple transmission events throughout our industry now, whereas as of 10 days ago, no clubs had been shut down at all for temporary closures. I'm going to move off of temporary closures for the sake of time. A lot of high intensity and low intensity group fitness clubs reached out to us after the NDP provincial government's announcement that they were going to support fitness clubs that had been shut down recently. I think it was in March that they shut down low intensity group fitness. High intensity group fitness reached out to us and said, what about us? We've been shut down for 10, 11, 12 months of the last 14, 15 months, and they're not supporting us. So Sarah and I immediately got a hold of Premier Horgan's office to get a meeting, and we've actually secured a meeting with the Premier's office for next Thursday, where we'll advocate for all of fitness that has been shut down since last November, and see where we can get. But we may be reaching out to some of you brilliant minds to ask what the ask should be. So people like brilliant people like Dave Hardy and Mo and who else? No, that's about it. I think that's all the smart people we have on the call here today. So we'll be asking some of you guys for some advice in terms of an ask, and we would appreciate your assistance with that. And that's the updates I have, unless I know, Sarah, I will allow you to speak if you have anything to say.
I have nothing to add. It's always such a privilege when Carl allows me to unmute myself. We now play a game in where Carl will sometimes actually mute me because he's the host. So we try to minimize, if you're ever on a call with Carl, try to minimize the ability for him to be the host. That's what I do now. Yeah, no, we are, doing our best to keep every single part of fitness open that we possibly can in BC, because we know then that we can level up and level up and level up when the opportunity comes. Every step we take backwards will be another step forward that we have to take when we can open. So Carl and I also released a formal statement and shared with all of the media in response to that Kelowna gym that was doing no masks and no vaccinated members. And so, we see it as an opportunity to get out there in the media and share what FIC is doing, what FIC member operations are doing, the strength of the fitness community. One of the questions we were asked was, do you think that these kind of bad apple stories kind of cloud the rest of the industry? And we were able to share a lot of really positive stories, and that this is really a platform for us to share that fitness is safe and that fitness can be open. And so we'll continue to take any of those bad stories and create some really positive key messaging around it. So, but other than that, I won't bore you guys with anything else from BC, but
thank you so much. And I know we're out of time here, but I do want to let you know that we are doing education sessions that are powered by CanFit Pro, and our next one is on April 30th. And Mo, can I quickly get you to just speak to that, please?
Sure. I know I will ask that Trisha puts into the chat box the link, just if you want to hear more about our speaker. But I'll quickly just tell you that we have CEO and founder of Inspired HR. Her name is Debbie Caro. She is from BC. She is a well-recognized HR expert. She advises businesses on optimizing the workplace experience to be the employer of choice. And she helps businesses implement strategies to get the most out of their most valuable asset, which is people. The topic will be 2021 expectations of recruiting, hiring, and retention. And Debbie has a very long bio on all of the awards, including being the youngest inductee into the top most powerful women of Canada. So I hope that you'll all be able to join in on the 30th, and I will put it out to you that if you'd like specific help, we will be launching a couple poll questions, but if you really have some specific things you want to address, please email me at mohagan@canfitpro.com and I'll pass the information along to Debbie. We look forward to seeing you all there.
Wonderful. Thank you so much. And that wraps up today. So thank you everybody for coming. And those who are PC members and board members of FIC, I'll ask you to just jump on the next call, the next Zoom link, because we have our meeting. So see you shortly and enjoy your Friday, everyone.
Thank you.